started here. Um, Welcome everybody. Good afternoon. Just to let you know, Leslie Ann's going to be joining us. She's got something else she's got to take care of, and so she's joining us as soon as she's able to. But we're going to go ahead and get started. Welcome to the Jurisdiction Advisory Committee meeting. We've got a full um, afternoon planned in the meeting, and we've got some presenters. So we do have, if you guys can just, uh, if you want to advance the slide, Martha,
Mhm.
just to check in, and if you guys could put who you, since you know each other, if you could just introduce yourselves in the chat again, and then I'm going to introduce or have our three folks who are presenting today at least just introduce themselves before we get to their presentation, so you know who they are on here. Um, Nicole, Jennifer, and Jessica. Nicole is actually one of the members of the committee, but I'm going to have her, um, I'm going to have Jennifer and Jessica introduce themselves. Go ahead,
Thank you.
Jennifer.
Thanks, Sylvia. My name is Jennifer Sorensen. I use she, her pronouns, and I'm a program manager at the Oregon Child Abuse Hotline. Thank you very much for having us.
All right, and Jessica Austin.
Yes, good afternoon. My name is Jess Austin. I am a project manager with Child Welfare serving the Family First projects. And I'm stepping in for Mary Geelan today, who's taking care of her sick little baby. So glad to be with you all.
Yes, thank you very much, Jess, for joining us on such short notice. Um, and Nicole's part of the group, but she's also going to be doing some presenting this afternoon for us as well. So um, if we could just go ahead and go to the next slide. All right, so today we're going to have three people, the Jess you met, Jennifer and Nicole, talk to us today about alternative pathways, really prevention services that are in existence in Oregon now or that are being planned for implementation or that are in some stage of implementation. And Nicole is going to be able to tell us about the services that already exist out there as well. So it will be hopefully a fruitful conversation and information sharing. We're going to um, spend the afternoon hearing from both of the subcommittees about their findings that they have after meeting on the side, outside of these meetings. So there's the jurisdiction subcommittee and the definition subcommittee, and we'll have some brief presentations from them. Then we're going to talk about what our work is going to be in terms of assignments moving forward, continuing to use the subcommittee process to moving that work forward, and what our next steps will be. So that's our agenda for the day. Next slide. Just a reminder of our community agreements. Bring our curiosity, reflections, vulnerability, skills, courage, and authenticity to this work. Keep ourselves and each other focused on our mission in general, on this moment. Open ourselves to each other's perspectives, experiences, and suggestions. Stay oriented towards solutions that move us towards our goal, and seek out, engage, and respect all voices of those impacted by our mission. Next slide. So we wanted to just remind ourselves, our values back up that we agreed to around guiding the committee recommendations. We part of the reason for just bringing back the values is really to just ground ourselves in why we're all here, ground ourselves in the work that the subcommittees are doing, and in moving forward with additional work that subcommittees will be doing is just make sure that we're staying true to what those values are. So above all, we're striving to keep children safe from harm, equitably treat all individuals involved in safety determinations with honesty, integrity, dignity, and respect, avoid re-traumatization of children in efforts to keep them safe from further harm, and offer healing interventions and seek justice, reduce disproportionality of children and families in the child welfare system, share responsibility for child protection with the community, and maximize the efficient and effective use of available resources. We wanted to just really focus on share responsibility for child protection because that's what we're going to be talking about in terms of one of the subcommittees reports out later today. All right, next slide. All right, so we are going to have a presentation right now on alternative pathways, and we're going to stop our slides because Jennifer, Nicole, and Jessica are going to be presenting their own slides, so we'll be showing their slides. Once again, Jessica is sitting in, and I heard her say Jess, so I'm going to call you Jess. Jess is sitting in for Mary Geelan, who has a sick child, unfortunately, but I'm sure Jess is just as prepared as Mary was to speak with us today. And so if you guys want to go ahead and get started, that would be great.
Sure. Are we sharing? Would you like me to share our slides?
Whoever of the three of you, Nicole?
I can share them also and advance them if you'd like.
Sure. Yeah, that's fine, Martha, if you want to take that on. Thank you.
Okay, let me get them up.
Perfect. Thank you so much. So yeah, today we're going to be talking with you about prevention in Oregon. Next slide, please. So this, oops, my dog is barking. The first guiding principle in child welfare vision for transformation is a focus on supporting families and promoting prevention. Our vision for transformation is based on a belief that providing earlier, less intrusive support for families means more children can remain safe and healthy at home. This prevents children this helps children have better long-term outcomes and keeps the bonds and connections critical to their well-being. As you can see in this image, when we are talking about prevention, most of it exists in communities before child welfare is involved through programs that are universally available to families. They serve the needs of specific children and specific families, and they prevent maltreatment. So while we're transforming our system to be focused on promoting prevention, we can't own prevention, and it really has to be owned by our communities. We believe that communities often already have wisdom and assets to provide safe, stable, and healthy lives for children. Thus, we, within child welfare, are working to partner, listen, and lift up community voices and their decision-making powers. This builds existing resources, it creates pathways to new resources, and promotes community interdependence rather than a system of dependence. So with that in mind, we'd like to start by handing off the discussion of prevention to our partners at Prevent Child Abuse Oregon to talk more about the broader community-based prevention services prior to talking about the work that child welfare is doing related to prevention. Next slide.
Thank you, Jessica. And thank you for queuing it up for us to share with you more ahead of the discussion about state agency prevention pieces. So I'm really excited to be here with all of you today just to share a little bit more about what we know of that exists in the community. Prevent Child Abuse Oregon doesn't have all the answers, obviously, but we are working on really increasing visibility and building trust in the community-based organizations that we know can support kids and families. We've spoken to some hesitations in this group, right, because there's this kind of lack of sophistication in a lot of ways around how we coordinate community-based referrals and community-based systems, especially compared to maybe some of the state systems, right, that are a little bit more further along in those processes and have been doing this kind of coordinated approach for much longer. So today I'm going to share with you a little bit about some of those discussions and pain points that we've identified and what we're doing to try to help bridge some of that. So next slide, please. I also know that at the beginning of this project, we all had a chance to come together in person. I was not able to be there, and so I included this slide with a little bit more context on my background, a little more about my perspective. I'm not going to spend time on it right now, but you will have access to these slides. So if any of you are curious about any of the pieces that I bring to this work, I wanted to provide that to you since I wasn't able to during our in-person kickoff for this. Next slide, please. I will also not spend too much time on this section, so I'm just going to give you this as a really quick overview of who Prevent Child Abuse Oregon is. We're the Oregon chapter of Prevent Child Abuse America. So while we are working statewide in Oregon on prevention and really specifically focusing on things like prevention and partnership, upstream prevention, we're looking at how policy and advocacy pieces support prevention, and then of course the awareness components. We're also doing this work in partnership with our national network and the National Office of Prevent Child Abuse America. So we bring that perspective. Yes, we're rooted in Oregon and in the work that's happening here, and we leverage these national perspectives and our sister chapters all across the nation to help inform our work. Next slide, please. So what I'm going to do today is just spotlight one really important element of the work that we do, which is this prevention and partnership approach. What I'm going to share with you today, and I can drop a link into the chat here for the Prevent Child Abuse America Theory of Change if any of you are feeling really excited about diving into a little bit more about the framework that we're using. But we are working on helping to support an ecosystem of prevention in Oregon. And so in synopsis, we're working to uplift a coordinated approach to child and family well-being across the lifespan that really centers the whole person, the whole family in the context of their community. We're focused on primary prevention, which means that we're talking about the resources and services that kids and families should have access to long before a crisis occurs. We're also talking about an approach that is not specific to any one strategy or any one age range, right? We are looking at comprehensive well-being for kids and families across the lifespan. This context feels really relevant to the discussion that we're having in this subcommittee, specifically because it illustrates that this work is happening in our communities and we're moving forward together, even if we don't have all the pieces figured out yet. So I wanted to make you aware of some of these conversations that we're having and what's moving in the community. That way we can use those things to help inform the recommendations that we make as a subcommittee for some next steps and where we might want to go. Next slide, please. So in order to do that, I am just going to give you a little bit of an illustrative process here to walk through what we hear from people about what it looks like right now to access services in your community. So this slide illustrates a parent who is seeking support to navigate multiple needs. These are things like access to high quality childcare, mental health support, parenting education, rental assistance. Any of these needs could present at any time, and they're all presenting long before a crisis occurs for kids and families. You know, these are things that any of us could experience on any given day. These are also everyday challenges that can be supported by community-based programs. These are things that if not addressed, right, we also know that they can become a concern and that they can set the family on a path to interact with child welfare or the juvenile justice system or expensive healthcare systems, those kinds of things down the line. Next slide, please. Sorry, I've got all my notes up in front of me as well, so I'm just making sure we're on the right one. Thank you. So this next slide here, we really wanted to illustrate many of the resources and supports that exist to meet the needs of caregivers in our communities before they're in crisis. So instead of giving you like a whole list of every prevention resource that we know about in the state, because that would be a massive list, I don't think that would be the most helpful format to offer in this context. What I did was just pulled some examples of community-based organizations that might be able to help meet those needs that the caregiver is presenting with. You'll see some of these might involve state agencies, right? So in the case of accessing public assistance or finding childcare, where the state system is helping to navigate those options. You also see that here with the CCOs being named. Most of these options exist outside of state systems, demonstrating those many ways that communities can care for each other before there's a crisis. Next slide, please. Okay. So this slide here is meant to illustrate some of the challenges currently people face when they go to navigate services. Particularly, like I said, I'm focused on the community-based approach right now. So in this illustration, we hear people talking all the time about current expectations for things like, you know, there are services that are siloed from each other. These things are not sharing common applications. We're not sharing common referral pathways. We often don't even use the same language in the way that we talk about the work. And it's not making it easy for people to be able to access these different services, right? What you see here is that people note how frequently they're being asked to apply multiple different times or to access a bunch of different resources and services that have different criteria, different requirements, different restrictions, physical locations. They're not co-located, right? There's not a lot of opportunity for people to have these kind of easier access points in the current system that we have. This is where I would say we've identified a really significant growing edge in the community-based infrastructure to support child and family well-being, as we have yet to develop those really robust kind of shared data systems across sectors, those common referral pathways that look at the whole person, the whole child, and the experience they're having, and really give us that united cross-sector approach. Next slide, please. So this is just to share with you a little bit more about what we hear from people who have navigated our systems currently, including, right, the community side of things. So we hear a lot that it's the same stuff that you all hear. It's people get overwhelmed and frustrated trying to seek help. The overwhelm builds and it bubbles over. Best case scenario is that people find other ways to support themselves and to just get by without accessing the resources that we know could help lighten the load or make life easier, make parenting feel more accessible, make people feel like they're not in this alone, right? There's a lot that people could benefit from, even if they're not in crisis, that people are not accessing because they get so overwhelmed and burned out by just trying to seek help. Worst case scenario, of course, we all know that people fall into crisis and intervention becomes needed down the line to ensure child safety. Next slide, please. So we've been really in this space of trying to figure out what could a better system look like, a better public-private approach. What could we dream of together that could really help meet these needs? I know this is a text-heavy slide, and that was intentional to really illustrate, right, that there's a lot of enthusiasm and a lot of ideas that are out there percolating. A lot of people are talking about this exact concept. How do we really build the infrastructure, that kind of connective tissue between our sectors and our programs to make sure that we're being intentional and that we're coordinating to really create this network that is sustainable? I'm not going to read through every single thing on this slide in the interest of time, but I did want to just share with you, right, there's a lot of really important pieces that a lot of different people are holding. A few that felt really important to me that I just will highlight here. This coordinated, sustainable ecosystem of prevention where whole child, whole family well-being is at the center instead of focusing on crisis or focusing on abuse prevention, right? We're really trying to kind of push the shift towards well-being and centering that in a lot of the work that we're doing. I also want to name, right, the cross-sector coordination has come up over and over and over again, where people are saying people are desperate for this connection between the different pieces of the work to make it easier for them to access. One other thing I want to highlight is the second and the last one. Trust in communities to care for each other and then modeling that at the state level through authentic partnership, resource allocation, and policy and decision making, right, that allows communities to have some of that power shifted back to them in terms of decision making. So I highlight that because of what you're going to hear, in the next section from our state partners around how they're trying to do that, how they're trying to shift some of that power to communities to really share that decision making. Next slide, please. So this slide is here to illustrate a concept, and this is just one example of how community-based organizations are trying to get better about this sophistication, right? Trying to create better cohesiveness within our different sectors. So this slide illustrates a concept that's being worked on right now in partnership between Prevent Child Abuse Oregon as the Family Resource Center network host in Oregon, and then the contingent as the Oregon lead on the Thriving Families, Safer Children work. The idea is a cross-sector network of community-based organizations that are united through shared data, shared goals, shared language, a simpler access point, something that could be leveraged virtually or in person through a family resource center. This is just one example, though, of how we're trying to think through what could better coordination look like? What could it look like if we do the work as community-based organizations, state partners on the front end, right, to really get better about that coordination and about that cross-sector approach so that when kids and families need help, they've got, an easy access point. They've got somewhere in their community they can go to really seek that resource navigation across sectors instead of just within our kind of narrow silos. Next slide, please. So I wanted to share a few other things with you as well around how we are, as Prevent Child Abuse Oregon, watching what's happening with prevention across the state and then showing up for that work. So the first thing I want to highlight is that Oregon has a huge array of community-based and community-led programming that exists, right? So we are watching all the different things that exist and really, really being thoughtful about not duplicating things that already exist when we're thinking about how we create alternative pathways. So we're bringing those cross-sector partners together and really working to support things like shared values for prevention, shared learning, collective well-being through our Child Abuse Prevention Collaborative, which a few of you actually are part of. The next thing I wanted to highlight is that coordination is happening within silos, right? So you've got your like early learning hubs, you've got your parenting education hubs, you've got your domestic and sexual violence resources, all these different places where people are already doing the work of coordinating within their sector. We have taken on a project with the Center for Child Safety and Wellbeing out of U of O, which was formerly CPAN, where we're working with them on a statewide asset and gap mapping project that leverages those gap mapping pieces that have already been done, right? We're looking to put together the bigger picture of what the child and family well-being landscape in Oregon looks like, leveraging those existing kind of coordination efforts happening within silos. Just a few more here. There are flexible national models that can help attract diverse, sustainable prevention funding. We have become the Family Resource Center Network host in Oregon, specifically because this is one of those models that can really draw and attract new forms of funding that are not currently being leveraged in the state. So we're trying to help build some public-private avenues in partnership with some private sector and business folks around prevention and sustainably funding this work. Lastly, we're trying to show up in a whole bunch of different legislative coalition spaces to understand the policy priorities that are moving at this time and look for opportunities to be able to connect the dots across those different initiatives to really give a more comprehensive picture of what policy impacts might happen as a result of legislation that's being put forward. Next slide, please, and then I'll be done and pass it back to our state friends. So the last thing I wanted to just say here, right, is it's really like I started. This work is happening in communities every day to help create the system that prioritizes people, community voice, and shared power. It's happening. We don't have all the nuts and bolts figured out. We don't have all the coordination pieces nailed down yet, right? But it is happening right now that we're trying to help build that system. I wanted to highlight the resources and the shared shift in our priorities, right? Knowing that it's going to take time for us to really be able to center prevention as so much of our funding has gone downstream historically in this state. We're working with champions within the legislature, within our state agencies, and in the private sector, like I named, to really think through what those uncharted avenues are to elevate prevention in this state. Lastly, I really appreciate you all just allowing us to have some space here and to have this conversation, because the reality is that like the recommendations that come out of this subcommittee have real ramifications for how prevention can impact this partnership going forward, right? How we can leverage those community-based organizations and the work that we're doing. So I really am just appreciative of having the opportunity to share some of this and to help you all see that this kind of coordination is possible, right, in a public-private partnership. So that's what I have for you today. My last little slide, if you just hit the next one, is just a little graphic that we are in this together. So with that, I'll pass it back to our state partners.
Thanks, Nicole.
Yes, thank you, Nicole. So family first prevention. Next slide, please. So when we think about prevention, child welfare absolutely has a role to play. And one thing that we always ask ourselves is, what are we preventing? And so as you can see, there are many programs within child welfare that touch on various types of prevention. There's prevention of child abuse. In this area, child welfare's role is focused on community resourcing and advocacy. We provide resources that don't require an open child welfare case. We advocate for resources and be actively involved in with the community and others to provide prevention services. Second is prevention of child welfare system involvement. We know that our staff knocking on your door alone can be traumatizing to any family. So in this area, child welfare's role is focused on referral to community resource and pathways. This still involves existing community resources and supports their prevention work. And then third, prevention of foster care and prevention of re-abuse and re-entry into foster care. We have a responsibility to preserve family and community connection. The Federal Child Welfare Abuse Prevention and Treatment Act requires states to have a triage procedures for the appropriate referral of a child not at risk of imminent harm to a community. the organization or voluntary preventative services. This does allow for child welfare to partner with other ODHS programs and community to expand strategies and activities offered to populations with risk factors associated with well-being or child abuse to build protective factors and mitigate risk factors. Next slide, please. I'm a little bit tongue-tied today. So the Family First Prevention Service Act was passed in 2018 and fundamentally changed how Title IV-E funds are used within the child welfare system. Prior to its passage, federal Title IV-E funds could only be used to support children once they were placed into foster care. Now these funds can be used to support prevention services related to mental health, substance use disorders, and or parenting. And when the Title IV-E funds are applied to prevention programs, there are no income requirements. For states to access these Title IV-E prevention funds, they must develop a Title IV-E prevention plan for that particular state. In 2021, Oregon's Title IV-E prevention plan was approved by the federal government, allowing us to claim federal funding for services that are outlined in the plan. Also in 2021, the Oregon legislature gave child welfare state funding to support prevention programs that are not eligible for federal reimbursement. This initial Title IV-E prevention plan was always envisioned as a first step on the path to continue to promote and expand investment in services to support families and prevent children's placement in foster care. So this year, with engagement from people with lived experience, sister agencies, and community-based organizations, we have begun the process of planning to amend Oregon Title IV-E prevention plan, reimagining which families are served, which services we provide, and the pathways into those services. Next slide, please. Oregon's Title IV-E prevention plan includes the expansion of 4 evidence-based practices listed here. They are just now beginning to be implemented in various jurisdictions around the state. The one caveat to Family First is that we can only fund prevention services that are deemed to be evidence-based services by the Federal Clearinghouse. So, with the state's funds that were given to child welfare starting in 2021, ODHS is now able to make investments in culturally specific programs, cross-program partnerships, services to self-sufficiency clients that used to only be available to child welfare-involved families to prevent the need for child welfare involvement, and research and growth of programs that might be able to be part of the Title IV-E Prevention Services Clearinghouse or in Oregon's plan in the future. Next slide, please. And with that, I'm going to pass it over to Jennifer Sorensen, who's going to talk about prevention at ORCA.
Thanks, Jess.
Yeah.
So thank you again for having us today. My name again is Jennifer Sorensen, and I'm a program manager at the Oregon Child Abuse Hotline. Next slide, please. Today, I would like to briefly share with you about 2 referral pathways intended to prevent child abuse when a concern is reported to the Child Abuse Hotline and when the concern is then closed at screening. And I do have a disclaimer about the numbers on this slide. They're less than perfect, but that's because I opted to share very current numbers with you before every report from January has been settled, but they're not too far off and the trends are consistent. So let me take a moment to walk through this slide. And it is my understanding that a lot of this is a refresher as it relates to information that Sarah Walker shared with this group a while back about the structured decision-making tool that we use at the hotline. But the referral pathways I want to share with you today start with a concerned person calling the Child Abuse Hotline. So it's all relevant. So a concern is reported to the hotline, and I'm sure that most or all of you have had the experience of reporting to a child abuse hotline in your career or in your personal life. So this is a reminder of what that process looks like a bit, maybe on an end that you weren't as familiar with. So when the concern is reported to the hotline, our understanding from the hotline side of things is that a reporter believes they're reporting child abuse, or the reporter is unsure if their concern would be considered as child abuse, feels compelled to call because of that, or the reporter isn't sure who else to call and they're just concerned about a kid. That happens too. And for context, in January, 15,015 contacts occurred at the hotline. Now, next, the hotline collects information and uses structured decision-making tools to determine a screening decision. So the contact is either not abuse related, that happens. Maybe it is sent to Otis, which would be the non-familial, more professional related concerns. It might be determined to require a case note, which we do for open cases, open child welfare cases. It could be duplicate information, it could be assigned, or it could be closed at screening. And stats for January of 2025 would show that 8,039 reports came from those 15,015 contacts. And that of those that were created, that ultimately created a report, so of that 8,039, approximately 50 were assigned and 50% were assigned and 50% were closed at screening. Now, this is where the numbers get technically very inaccurate for something that just occurred a few days ago. But I want to assure you that that 50-50 split in general is a fair understanding of our system for you to move forward with. So next is where the meat of our conversation today lies. That metro area reports that are closed at screening are then also screened for a prevention referral. So LifeWorks Northwest and problematic sexualized behavior committees receive referrals when a closed at screening report is eligible. And I do want to acknowledge that the term problematic sexualized behavior, those committees, some folks are using different names to describe that phenomenon. And I hear that, I respect that. And the term that's being used in my context is still PSB. So that's what I'm using today, but it's the same thing. This is what I'll explain a little bit more about, but in January, there were 17 referrals made to the PSB committees, 52 referrals to LifeWorks Northwest. So I want to explain LifeWorks Northwest first. The Portland Children's Levy provides grants to service providers in the community with the explicit goal of preventing and intervening on child abuse. And one of their original grant recipients is LifeWorks Northwest, which serves to enhance parenting skills and connect families to resources by providing home visits, case management, peer advocates, parenting classes, outreach, and more. The PCL grant to LifeWorks has been based on Multnomah County Child Abuse Hotline referrals based on closed at screenings for over 30 years now. So that's prior to the Child Abuse Hotline centralizing, but we carried on with that practice. And this practice is now being evaluated by the Doris Duke Foundation's opt-in initiative. And we're looking forward to learning more from that evaluation in the coming months and years. And our participation in the opt-in initiative has already provided an opportunity to improve our referral process. And we've seen an immediate increase in the number of referrals that we've made in January over prior months. So in January, those 52 referrals to LifeWorks Northwest was restricted by zip code as a way of matching capacity compared to need. So instead of every single closed at screening within Multnomah County or within Portland, we know that LifeWorks Northwest actually doesn't have the capacity to contact every single family that's the subject of a closed at screening. And so we have matched their capacity by specifically evaluating for particular zip codes. We hear from LifeWorks Northwest that the number 52 per month is about their capacity right now. But I do want to acknowledge that more funds to LifeWorks Northwest or similar services will allow for more referrals. So on our end, we have no problem sending more referrals. In regards to this specific pathway, it would be a capacity issue on the other end. So in addition to the hotline pathway, I do want to highlight that families can be referred to LifeWorks Northwest and similar programs, of course, by schools, open ODHS cases and assessments, and individuals can even self-refer. So all of that's very important to acknowledge and very related to what Nicole shared with us earlier. So the other referral pathway from hotline closed-it screening reports that I want to highlight is problematic sexualized behavior referrals. And the process for those referrals on our end at the hotline is very similar to LifeWorks Northwest in that we have one screener at the hotline who pulls closed-it screening reports for the available counties and then does do a review of those to understand whether the concerns in those reports were related to problematic sexualized behavior and refers to the related PSB committee. Those are related to multidisciplinary teams, MDTs, which are funded statewide. But we only have agreements with 3 or 4 of those committees right now. And so as this group, you all might be interested in thinking about potential scaling up opportunities. Any MDT could have a PSB committee and we could expand our referrals if other groups were interested in receiving those referrals. Now, a third pathway that I do want to mention is based on closed-it screenings, but not from the hotline, is also being evaluated by the Doris Duke Foundation, and that's occurring in Klamath County, where the ODHS office pulls a list of closed-it screening reports associated with their area and refers those who could benefit from the self-sufficiency programs to self-sufficiency program life coaches. Family coaches. This directly aligns with one of the opt-in initiative's areas of focus, which is to evaluate the efficacy of concrete financial supports in preventing child abuse. And that pathway, that style of referring families to family coaches, there would be some difficulty scaling up, but again, an investment. Otherwise, there's no reason why it couldn't be done. I know that some of us wonder about reporting back from services if concerns reported were the pathway that people were referred to services through. In a closed-it screening environment, some people are still very concerned about families. And I just want to highlight that if we needed to hear back about service completion, that would more be related to the type of report that would actually be assigned in. So remember that we're talking about families who, from child abuse statute perspective, don't need to be completing services. What we're doing is trying to get ahead of concerns. We're trying to offer things to people where the state otherwise wouldn't have been providing them. So we do want to hear back from programs to understand their efficacy, but we're not going to be recording whether a particular family followed through with services. So that's something to acknowledge. And that while making referrals to voluntary community-based services on reports that are closed-it screening is a way to connect families that seem to be in need of help, it can't be the only pathway to those services. So it does make sense for child welfare and the child abuse hotline to be involved with preventing child abuse, but we don't want to suggest that we become the primary source of referrals to community-based services. Of course, I'm tying back to Nicole's work so directly here. But for example, self-referral and referrals from schools, that type of community safety net is really important so that we don't inadvertently refer more people through the child abuse hotline than would otherwise have been called to us about. So thank you so much. And I don't know if you have time for questions, but we are available for questions.
We do have time for questions, so I wanted to thank you, all 3 of you, so much. It's such a wonderful presentation with a lot of information. So I just want to open it up to the group and see if you guys have any questions for Jess or Nicole or Jennifer. I did have a question, Nicole. I want, the work with, the work that you're doing to center all of these services and then prevent child abuse really being an organization that's pulling them together and doing some lead work around training and capacity building. It's very refreshing to see that. It's very much after the model of what San Francisco has done with their 26 family resource centers in such a small space. Are you guys using the five protective factors to guide that work, or something similar to that?
Yeah, so we just recently became the Oregon Network host through the National Family Support Network, which is the entity that exists to regulate and really support family resource centers nationally. And they do have like a framework that includes standards of quality that, you know, are across the board, that we see the same standards in every state. We are at the very beginning of the actual FRC network development in Oregon. We just took that step just a few weeks ago to actually become the network host. We've been doing a feasibility study for over 2 years at this point to look at the landscape of prevention in Oregon, to really be thoughtful about how the Family Resource Center model could leverage what already exists and then draw in additional funding for prevention specifically. So yes, we will be using a lot of the same, you know, frameworks and approaches that exist across the nation to really create that standardized approach. And we're being really, really intentional and thoughtful about how do we shape this to make it useful in Oregon, right? To make it a value add here, where it's not creating a whole new infrastructure of programs that don't exist, but rather looking at how this model can bolster and support the current landscape of existing work through all these different community-based programs that already are here and thriving in Oregon. Thriving as much as they can be without dedicated prevention funding, staff bandwidth to really carve out time. You know, there's a lot of things that we know we need to include and infuse into our prevention, community-based prevention efforts here to make it that prevention's a priority, but we are leveraging those national frameworks to help us chart that course.
Sylvia, this is Leslie Ann. Hi, everybody.
Hi, Leslie Ann.
I made it. Thank you so much again to everybody for the presentation. I was just curious, and I think this would be maybe to Jennifer, on the Metro program that you're testing out right now. I know you focused on a couple of zip code areas, right? And you kind of gave the numbers that might funnel into that, and landed at 52 is the capacity for that particular program right now. And you may not know this till you finish your evaluation or something, but I was just wondering if there's a sense of, does that sort of meet the need that's represented in those two zip code areas, or is it like less than the identified need in those two areas, or how does that sort of gauge against, you know, the ability to respond versus the demand, if you will?
Yeah, thank you for that question. So the number 52 does, using this model, represent the need in just those zip codes, but it's just those zip codes. So Portland Children's Levy intends to serve anyone within the Portland boundaries, and but the money doesn't match the need. So that's where the unmet need is. But in those particular zip codes, the number 52 does match the need.
Yeah. Okay, great. But there's obviously more zip codes possible that would have that in that area. Yeah.
Exactly.
Okay.
Yeah.
Thank you, Jennifer. Other questions for any of our panelists?
In the comments about Families First, there was a comment about no income requirements for some of the services that are approved under that. Could you say a little bit more about what that means?
Yeah, I can. So for families that meet the candidacy population criteria, then there are no income requirements for those families to obtain prevention services through Family First. And so, for instance, if you have a family who is in need of parent-child action therapy, then that family can, and they meet the requirements to be a family first family that's served by Family First Prevention Services, then that family can receive those services without any, like there's no eligibility for them to be provided to that family. Does that make sense? Like no income requirement, I should say.
So Jess, when you're talking about meeting candidacy, you're meeting candidacy for child welfare, right? So that they're,
Meeting
is that what you're,
meeting candidacy for our prevention plan. So the candidacy populations for our prevention plan are very specific. And currently we're in the process of amending that candidacy population to expand services to more families, more individuals. And so currently the only way for families to receive prevention services is to come through the child welfare system at this moment in time, whether that be a call to our hotline or families that are already involved in the child welfare system. Right now, our design team is really looking at other pathways for families to come to be able to receive prevention services through Family First without having to be engaged in child welfare specifically.
sorry.
Yeah, I had a question on the youth with the problematic sexual behaviors. You're referring those out to other organizations that are kind of, I guess, handling those. Did I hear you say that that's not something that gets written down on the referral, or is that? So I guess my question is, because I mean, we're talking about starting one here within our county, and so I've met with a couple other organizations that are doing that work, and the engagement is pretty low for getting families to engage in that process for their child of getting treatment or education around those behaviors. And so if another referral or another call comes into the hotline, is that something that you would know there's a previous call, or did I hear you say that that's not something that gets written down?
Thank you very much, Tori. That question makes a lot of sense. So we do track who we're sending referrals about. So we would know that we had sent that family or that child's situation to their local PSB before, and the PSB also keeps track. So their PSB committee also keeps track, so they would know that they had seen that kid before. In fact, it's common, you know, we will send a referral thinking that this is a new child to them and they've already been aware, for example. That's really common. So we would know if we were, you know, repeating, and the program on the back end would know what that engagement was like. So what we don't keep track of at the hotline is the service outcome, but every little piece of the program, like every little piece of the process does. And we know about sort of success rate, if you will. Like we are generally curious about, you know, how the programs go. So we understand, just not on a person specific basis. Does that make sense?
Yeah. And have you experienced calls coming in for families that didn't engage in treatment, generated a new call to the hotline? Is that something that happens, or?
So anecdotally, I will say yes, but we are on the cusp of knowing the answer to your question more concretely. So the way that we are tracking this, partially because of Doris Duke's involvement in our other pathway, but also just because this is an area that we're, you know, in the process of centralization, finally able to improve on. We're able to get closer to the real answer to your question soon.
Thank you.
Yeah, thank you. And good luck. We're excited that more MDTs are considering this. And I think that we'll be able to maybe offer a little bit of a bird's eye view. For instance, Yamhill has come on most recently, and they were able to benefit from learning from, either other MDTs or learning from us too. So
Yeah, just a little bit of feedback that I've heard around the process piece of that. I think Yamhill, actually the reports that come in to ODHS go to the police, and then they have to cut and paste it into a police report to go through. So, I mean, there's a process piece, I think, on a higher level that needs to be streamlined so that that referral process into the PSP MDTs is more effective.
yeah, I agree.
Thanks.
I agree.
Other questions? Anybody else have any other questions? Okay, well, we would really want to thank Nicole and Jess and Jennifer for the presentation. I thought it was very informative and gave us a whole lot of information for the work that we've got ahead of us. And so thank you very much for the information today.
Thank you all for your time. Take care.
Thank you.
Yes, thank you.
And well, Martha is maybe pulling back up our slides. I just want to mention that we will be integrating those slides into this slide deck when we do post this meeting material to our website. So you all will be able to have a copy of that available to you as well. Sylvia, do you want to pass the baton here, or do you want to frame this and then I'll pass it over to me? I'm sort of coming into the middle of the movie here, so.
Yeah. So, okay. So, as you all know, we have the two subcommittees that have been meeting pretty regularly since we started them in January. And there was the Scope of Jurisdictions subcommittee, which Leslie Ann helped facilitate, and then the Definitions Committee, which I facilitated. And we have individuals who are going to, from those committees, who are going to present to the larger group today the findings from those committees. But first, I'll turn it over to Leslie Ann to start us off.
All right. Thank you so much, Sylvia. I want to, if we can go to the next slide, I just want to, first of all, thank our subcommittee. The Scope of Jurisdiction subcommittee's been working really diligently, since January on helping move through this task that I'm about to remind everybody of. And I just want to specifically thank Sarah Walker and Adam and Annalise and Iris and Kristen Ward and Brendan, Scott, Lindsay Moore, Nicole, and Tori for their hard work. And of course, Lindsay Bigelow and Brian Flannery have been kind of our co-leads of this subcommittee. So that's just been a really important way for us to dive into our expertise here on the committee and have you help us shape these tasks. So the Scope of Jurisdiction subcommittee really emerged as one of the two kind of cornerstone areas of our entire scope of work, as we've all been talking about. And the task here over the last several weeks was to really try to identify and step back and take a look at the data, take a look at all of this great work that's coming through the hotline, and really try to step back and understand what's happening with that broad scope of jurisdiction that Oregon now carries, and identify any part of that beyond the familial caregiving traditional kinds of settings, including out-of-home care, that may be better investigated, addressed by other accountability partners, right? others in the community, others that are sharing the role of child protection with child welfare services in such a way that we could have potentially more solid outcomes with respect to safety and interventions that would be important in those circumstances. I think there's a second bullet here too, which was to kind of try to also, identify specifically, what those circumstances were and what those accountability entities are that may be best suited to address that area of the current scope that may be more difficult and not as effective for ODHS to respond to. So next slide then. We then took this kind of view that we had shared with the full committee a few weeks ago to really kind of just give an illustration of how broadly the current scope of jurisdiction exists in Oregon. We kind of read this from the bottom up in some way, kind of this ever expanding concentric circle idea that, we definitely have the traditional familial and in-home caregiving roles and settings where abuse and neglect may occur that involve parents and guardians and other those with familial caregiving responsibility for a child, including minors. And then beyond that, of course, the out-of-home caregiving role is another set of settings where Oregon is very committed to ensuring not only that children remain safe there, but even carry a little bit higher standard of safety in those environments where the child is in foster care or in a DD home or a congregate care facility of some sort, those child caring agency sort of category that it's called in Oregon, or any other paid out-of-home care provider, which could also be a minor in those circumstances. And then outside of that, we have other settings and environments beyond the sort of 24/7 placement environment, if you will, where ODHS is also responsible for pursuing, and particularly ODAS for pursuing abuse and neglect allegations in those environments, such as, school personnel, child care settings, again, minors, relatives who may be in coaches, people like that have some kind of other professionals, therapists or something that are providing some service to a child. So that kind of fits in that has temporary, care and considering the well-being of that child under their charge. And then there's this very outer circle, right, which is really no caregiving role at all, right, which is also included in Oregon scope right now because particular perpetrators are not named in the statute in any fashion right now. There's anyone can be a perpetrator in Oregon, and so that includes strangers, other community members, those with not only no caregiving role but no other known relationship to the child as well. Another student at school, a drive-by shooting, a internet predator that may gain access to a child. Those are all brought into the scope of child welfare investigations at this point. So, we really tried to take a close look at that. We had Lindsay pull some data from ODAS to see, really, particularly we were interested in this very outer layer. If you think of this as an onion in our graphic here, the very outer layer of that onion, because that was really where we got good input from our subcommittee that, those are maybe not having the kinds of outcomes that we would even want to see anyway for the amount of time and energy and effort that is required to investigate and fully create dispositions for those types of circumstances. And so I'm going to just lay that as sort of a framework for how we approach this process. The other thing we did is we really surfaced what circumstances fell into that category as maybe being, less effective or appropriate for ODHS to be the investigative entity, maybe not having the best tools to intervene in those situations, and most importantly, are not necessarily assuring safety any better than in any way, really, for the circumstances to be responded to. So with that, we generated an array of scenarios, and they kind of bubbled up into some groupings that we wanted to share with you today, that will describe sort of what we came up with as our findings out of this group. And I'm going to ask Brian and Lindsay Bigelow to help share what those findings are in the next, starting with the next slide. And I think we'll have Brian share that with us. And there's probably too much animation on this, Martha. So go ahead and click through, and there we go. Oops, yeah, there we go. That should have everything on there. So Brian, I'm going to turn it over to you.
Okay. So the first recommendation is recommend elimination of wrongful restraint and involuntary seclusion as abuse types. The subcommittee talked about this and also talked about recognizing that LC 346 that we talked of a little bit in our last meeting may lead to similar outcome. However, that has not happened yet, and we don't know what the changes that that legislative concept might go through. So we believe that this is still an important recommendation to make. And so under that, K through 12 incidents in violation of Oregon 339.29 would be reportable to ODE for action. Now, this is a return to previous practice regarding reporting, but how those reports are processed may be an area for discussion for ODE. And that also may involve some aspect of reporting to TSBC as well. Under B, child and care incidents in violation of restraint and seclusion regulations would be reportable to the appropriate licensing and oversight entities for action. And again, this is a return to previous policy and practice, and how previous to recent legislative changes. How these entities take action may need to be adjusted or reconsidered. So there might be some things, again, that need to be rethought. And then lastly, if another abuse type is present in any incident, it would require reporting to ORCA for action. And this is what previously had occurred prior to legislative changes. I think that was all we had on that section, unless there's something to add there.
Thank you, Brian. That's great. And we just have one additional slide, and then we can, or two, I guess, and then we can open it up to some questions as well. So we'll go ahead and pass it along to Lindsay.
Okay, thank you. So the other piece that we spend a lot of time talking about is who really is the best, is ODHS really the best entity for this, right? So one of the recommendations we have is amending the requirement that ODHS solely or primarily is responsible for making an abuse finding or determination on any allegation of child abuse. So this would allow us the discretion under pretty specific circumstances to close those reports at screening and pass those on or forward them on to the folks that may be better suited for that. And I know there's been a lot of discussion around this, and we'll continue to have some discussion, I'm sure, to get the language right. But situations such as, like Leslie said, allegations that where the perpetrator has no caregiving role or no relationship to the child, those would be a good example of something that's passed on to law enforcement for them to be able to make a determination whether they should be taking any investigative action, whether that's passing that to the DA's office after full investigation or whatever their determination is. But some of those examples Leslie Ann did touch on, we've seen like actual real life examples that we've had to open for investigation, drive-by shootings where children are in the house and they've got absolutely no relationship to the perpetrator. We've seen where two peers get into a physical altercation at school and one of the peers is 18. And so we have to identify that person as a perpetrator of physical abuse on a child. The online sexual abuse and exploitation where there's no in-person contact, I mean, that's rampant. We're seeing that everywhere. We're doing a lot of forwarding of that information to our federal partners as well as local law enforcement jurisdictions. Also just random acts. We've seen where a youth is in a park with their friends and a stranger is exposing themselves to them. Us trying to track down that stranger and make a finding is going to have no impact on that child's safety as far as an Otis investigation goes. So those are the types of incidents that we're talking about, that outer edge of the onion that Leslie Ann was referring to. And then also just a little bit further to reiterate some of the information that Brian was sharing is allegations that are truly licensing violations that don't involve any other type of abuse concerns that we are having to screen and assign as abuse investigations currently, such as violations of training expectations or staffing ratios, that those would go back to being looked at and determined whether licensing action is appropriate. So for instance, in school settings, we do share that information with our partners at Department of Education and TSPC, but we are also forced to look at violations such as whether a child should have been put in a restraint or not. Should there have been other action taken first? Pieces that were previously looked at as coaching, training, technical assistance that's needed are now identified as child abuse. We've also seen some instances where a child is being placed in a seclusion room, and rather than closing the door, the staff person is holding a mat up to keep the child in there. We still have to consider that seclusion. So those are some of the pieces in school settings that we're seeing. In childcare settings, I wish Adam was still here. He could definitely share some of his struggles with this. But we've seen where a child is being physically violent and has to be restrained, but the staff's training that's implementing that restraint has lapsed. They've been trained, they're doing the restraint correctly, but if they're not up to date on their training, it could be a day, it could be a year. We have to look at that as child abuse, as wrongful restraint. So some of those actions that previously were looked at and dealt with by licensing entities are now identified as child abuse. We would like to pass that back to the appropriate entities to do those pieces where technical assistance, coaching, training, personnel action may be more appropriate. Did I miss anything, Leslie Ann or Brian?
Sounds good to me.
Great.
What do you think, Brian? Yeah?
Sounds good. Thank you.
All right. And we just want to do one more slide and then we'll open it up to questions. But, you know, some of the things as we talked about all this, you know, it truly is an onion and a little bit of a tangle to unravel. And so, you know, one of the things that I know that, you know, Tori has been interjecting and sharing, and it was hard to fit this all in our month period of time here that we were trying to dive into all of this. But we really want to also continue to examine in the subcommittee, you know, the need for this group to make a recommendation on how allegations involving juveniles in correctional facilities are addressed, right? Just to make sure that that is absolutely clear and really supports not only the safety of those children, but you know, the accountability structures that are already in place in those environments. You know, what is, if any, the role of Otis or child welfare in any capacity. You know, those are definitely considered an out-of-home setting. If it's an incarceration setting, but for the most part. But we really want to. We didn't get a chance to really think that through as a committee, so we would love to continue to do that and kind of fit that into this model as well, so that there's some clarity around that. So other implementation considerations that flow just from the two recommendations that you just heard about would be things like, you know, considering more clearly what might be involved in the expansion of responsibilities of the TSPC or the education. Is this Accountability Commission or something? Sorry, I don't know what the acronym of EAC
Education
is.
Advancement Council.
Thank you, Iris. I wasn't quite sure on that one. And but these are you know, as you mentioned, Iris, kind of possible bodies that could help address some of these incidents, because there's a big gap here in right now. There's not a real clear oversight body for non-licensed school personnel, those individuals who are not teachers, but are in the school setting and certainly have contact with children. What is the appropriate entity or built out existing entity that could provide oversight and ensure child safety in those situations? Because we don't want to, any of these recommendations that we're making, our goal is not to leave anything uncovered. Do you know what I mean? We're trying to find better arrangements for ensuring safety, not simply removing responsibilities from ODHS and not being clear about where they would go and how that tight oversight would still occur. So those are some of the implementation considerations to fill that gap. And then the other thing we talked about was, talking about this idea of kind of this threshold of behavior. When you sometimes see a professional, and Brian, you can probably speak better this than I can, but there can be individuals in school settings or other settings where there's this pattern of behavior that may not rise to the level of abuse per se, but it's of concern over time. Or we don't want to have people just moving around from one setting to another and still have access to children if there seems to be a pattern of concern here. So are there threshold criteria or, boundaries around which this committee would want to speak to that in any way, given the experience that you have? Brian, do you want to add to that one at all?
Well, right now, for a person to become an educator in K-12, whether it be a licensed person, administrator licensed person, or a classified person, there's a background check that's run, but that doesn't mean that there haven't been investigations as far as related to any of these types of incidents, or not just investigations. I should more say that there's been findings for those types of things. And so it creates kind of a gap, and it's actually a gap currently with it. It relies on self-reporting of those things. And we know that we don't always get accurate information from people when they self-report. But it's a concern as far as if we see a pattern with that, and then somebody moves from one school district to another school district, it can be an issue of somebody that has a history of this type of pattern of behavior that endangers kids. So something just to be thought of. And again, I would say that it's still a hole right now, with the exception of if we have somebody that has a finding of child abuse, but there's nothing in between. You either broke the law or and it falls under a list of reports, or you didn't. And if you didn't break the law, then it's still a danger to kids possibly.
Thank you. And then the final one was just, we talked about this as well as we looked at the restraint and seclusion issues, that there's still definitely best practices that are important to reinforce around those situations that occur involving children and professionals, and just the consideration of investing in funding to more fully educate staff on techniques that diminish the need for the use of restraint and seclusion, de-escalation strategies and other kinds of techniques that will just minimize the use of this particular option as a way to either keep, manage children's behavior or whatever it ends up being used for, so that these can start to not be used as regularly at all. So I'm going to stop there and open it up to any questions or anything anybody else from our subcommittee would like to add or elaborate on, or just love to hear your reactions to our burgeoning recommendations here. Anybody? Can we assume that silence is agreement? Still absorbing it all. That's fair, Amelia. Thank you. Iris, go ahead.
Hi. So I am really glad that I was able to get in on this part of the subcommittee, because I feel like this is a really important tangible action here. And I appreciate Lindsay and Brian's leadership on this because of their particular professional experience and being able to bring that, both the education piece, because I've missed a few of the subcommittee meetings, so I'm glad Brian was there really to bring education into this conversation in a way that felt meaningful to us and our classified members. I still think that what I would say is I'm glad for the collaboration. I'm glad to be a part of this work. I don't feel like this is perfect in my opinion, but I'm glad to have these actionable items. And so I'm happy for Brian and Lindsay's leadership on this subcommittee. So thank you.
Couldn't agree more, Iris. Thank you for saying that. And by perfect, I'm assuming that you're kind of referring to they're not turnkey implementable in their current form. They're still kind of concepts. Or what are you thinking about there?
I actually disagree a little bit on some of the things. I don't like some of the wording a little bit. I don't love it when teachers are pulled out specifically.
Oh,
because there's a
sure.
lot of things that classified staff do in relation to TSPC, or there's a lot of overlap, I would say, other than holding a license, which is a very definitive thing. Classified staff that work in education settings have tons of overlap with certified teachers.
Yeah.
And having things that clearly delineate them, like the potential for having different agencies investigating them versus, certified
Yeah.
teachers, just feels like it separates it more. And to be fair, we're educators in statute now. And by definition, we're considered educators in statute. So to define us as other than that is to create vision where there doesn't need to be. And I think most of us here would agree that there are already far too many different avenues that these kinds of investigations can go to, and that muddies the water and makes it very complicated and hard for all of us to follow and advocate for our various groups and organizations and individuals.
Yeah. Yeah. Well, we would welcome more refinement on that as we go forward, Iris. Yeah. Sorry, did I see?
Brian
had your hand up first, I think. Yeah, go ahead. And then Kristen.
I put something in the chat there for you, Iris. I think your voice has been really important. I think what you just said is it really kind of gets at the point that I was trying to make. I think in some of the discussion is that I agree with you that there's this kind of weird division when it comes to what happens for classified in this kind of situation. I think we're both. And I'm speaking just education right now, and sorry to all the other folks that have the other areas that they're thinking about with these. But within education, I think it's important that we are taking an approach that is looking at how to look at some of these technical pieces as being opportunities for growth, for training, for improving our systems, helping people grow professionally. But then when they don't respond to that training, when they don't respond to that growth, when they continue to do things that endanger students, what group is going to take that on short of it being abuse? And that's where I think it's important to move this out of abuse, because it doesn't feel right that it's such a high bar for some of the pieces that we're talking about, but at the same time, there needs to be something beyond school districts necessarily that would be doing that. And so, it's like confusing because you've got certain accountability that happens that for both teaching and license and law, and also in contracts, you'll see that in places or policies of districts saying that instructional assistants, for example, might be held to the same ethical codes that teachers are in statute. And so what does that mean though for when something comes up? So I think there's important work to be done there, but I think for the good of both licensed, classified, administrative, the things that Lindsay spoke to as far as pulling those pieces out that are technical, that really would be best handled by a group that's treating that way and trying to support growth. And it's hard to find staff, and it's hard to keep staff. And part of that is too, now it's hard to keep staff when it's a zero tolerance policy for something that's technical sometimes, or could be.
Yes.
And that's not where we should be with this. Zero tolerance for certain types of things, right? If there's abuse in the traditional sense of what we've seen as abuse, physical abuse that happens towards sexual abuse, yeah, I completely am all for that, as far as having very strong remedies for that. But when it comes to technical pieces, we need to have that kind of growth that we're trying to support.
Mm-hmm. Thank you, Brian. And Kristen.
Thanks, Lizanne. I just wanted to echo some of what Iris said about feeling like maybe this is a good place to start, but isn't exactly fully refined. And I don't think that it has to be at this point, but in terms of capturing our idea and where we are in the discussions that the subcommittee has had, I do think this reflects it. I also just want to make sure that we're keeping in mind some other pieces of legal, authority or requirements that could be impacted here. Someone in our email thread specific to this presentation today made a really good point that perhaps Senate Bill 155 was enacted in order to comply with the federal Every Student Succeeds Act, which requires abuse investigations involving school personnel. I certainly don't have expertise with that bill and wouldn't have flagged that. So I think that's something we certainly want to keep in mind, understand what those requirements are. That said, I do wonder if once we have a good grasp of those requirements, if there's a way to perhaps suggest a statutory change or other sort of recommendation that weaves in that concern, right? So if if an investigation is required, is there a way to redefine investigation so that that could be conducted by the existing oversight bodies that we currently have in Oregon? We've heard a lot from different people, and particularly those in the school setting, that there are a lot of different folks that are conducting investigations or overseeing their conduct. And so it might be that we need to have, kind of correlating or corresponding recommendations that would address the problem more holistically or systemically.
Yeah, we need to get a hold of the Every Student Succeeds Act or whatever, right? That would be great.
Okay. Valerie?
Hi, there might be a provision or something in place already that addresses this, but as I'm thinking about if you are going to delineate and have different organizations or entities do investigations that are not child welfare, what are the communication channels if the child or youth is already a ward of the court? So they could be in a correctional facility and still remain a ward of the court. And these are things I think a court having oversight would want to know. So let's say you designate who's going to do an investigation in a correctional facility and it's not going to be DHS. If the child's a ward, is that communicated to DHS?
Yes.
One requirement and that our folks are really great about here in Lane County is if there's an assessment opened, we know about it. Not so kids' attorneys and parents' attorneys are just aware that that process and the court is aware that it's going on. So I know this is scope of jurisdiction, but it makes me wonder, okay, if these changes are in place, what are the pathways for communication and who needs to get that information about what's going on? So that's just a
Yes.
question I would have.
Absolutely. And I think that's a whole domain of implementation consideration, right? That would be one of those things we should speak to about patterns of communication. I mean, this even, I think, comes up too in terms of the other recommendation around the law enforcement potential involvement that, you know, you might want these to rise up in a different kind of way than just everything you cross-report now to law enforcement, just to close the loop on things, but that these are things that we're not going to respond to, if this goes forward, of course, we're not going to respond to, but they need to be responded to. So they're a little bit higher order, it feels like, right, than just the run-of-the-mill cross-report. So all of those communication issues of closing the loop, making sure everyone's clear on their role and responsibility, everyone's clear on actions that may be being taken in another arena that impact an individual that you have, you know, authority or control over. Those are all really important points.
Because, I mean, as an example, sorry, I didn't mean to interrupt. I'm going to have
go ahead.
best interest finding about whether a youth is going to be in a correctional facility. That's required by statute.
Mm-hmm.
I kind of want to make sure I'm not missing information that becomes important for the court to know. And again, we have this continuing oversight responsibility with
Yes.
youth as wards. So just wanted to put that out there.
Mm-hmm. That's great. Yeah. Okay. Tori, yes,
Yeah, I
go
was
ahead.
just going to add, there currently is some statute that requires notification of restraints that occur in detention within 24 hours to the youth's attorney, youth's parents, or if they're in DHS care, you know, if they're the custodial person, and that notification would go to them. So there is some processes in place. I'm not saying that that's all that needs to happen, but there are some currently some safeguards, or at least around notification that there was some incident that happened in a facility.
Mm-hmm. Okay. Brendan. Are you unmuted, Brendan? I don't see your. I see your hand up, but I don't see your little square. Let me see. Oh, there you are. Did you have a comment or question, Brendan? No? Okay. We got some good input from Brendan ahead of time, and hopefully address that. So I'm going to go ahead then. I'm just cognizant of the time here, Sylvia, and I know we wanted to take a little break at 2:30 for about 10 minutes and then roll over into the other subcommittees, progress and recommendations. So why don't we do that right now, and we'll take a pause, and if you all could come back, get yourself a refreshment, a little break for yourself, stretch, and then come on back at 2:40, and we'll keep going ahead. Thank you, everybody. And we'll go ahead and continue with our other definitions subcommittee report out. And Sylvia, I'll go ahead and turn it over to you to start that off.
Yep. All right. Well, I would like to thank the committee members for the definitions subcommittee, Sarah Stewart and Sarah Walker, Alexis, and Lindsay Bigelow, Alexis Amarelli, Anna Day, Samantha Finner, um, Kristen Ward, Chris Hinkle, and Annalise Sheehan. And then really thank Sarah and Annalise for being co-facilitators of this group and did a marvelous job. Our task was to look at definitions, and there's a lot of definitions, but this is where we focused on for this first part, the threat of harm and the neglect. So basically, once we started talking about these two definitions, our focus was review the definition of threat of harm and really think about whether there should be a recommendation to keep threat of harm, because there was some discussion about, we had said get rid of threat of harm, and I think we didn't mean it in that sense, but that's how it was interpreted. So we had to clear that up, and modify the threat of harm, or possibly move the issue of threat of harm to the appropriate abuse statutory definition, and then to review the definition for neglect or negligent treatment, and also make a recommendation as to whether that remains the same, or are there any modifications to be done. I saw Chris's hand up, so I'm gonna see what Chris wanted before I turn this over to Samantha and Sarah, who are going to present for this definitions committee.
Sorry, Sylvia, that was an accident. Ignore me for now.
Okay. Okay. All right, good. I'll go ahead and advance.
Yeah, so I'm going to turn it over to Samantha and Sarah, Sarah Walker, who I believe are going to present this information.
Okay, I mean, I'm happy to go. So can you forward and pull the whole
Get them. Yes, I sure can. Yeah.
Thank you for accommodating my needs.
There we go.
Perfect. So we had, like Sylvia had talked about, we had talked about the threat of harm definition. We had there was a lot of discussion about it, and you'll see that what the current threat of harm definition is threatened harm to a child, which means subjecting a child to substantial risk of harm to the child's health or welfare. There was a discussion about the word welfare, as it could have a lot of different meanings. So drilled down the definition with a proposed recommendation on modifying it, which is threatened harm to a child, which means subjecting a child to substantial risk of imminent harm to their physical, sexual, emotional, social, developmental, or psychological health, which I think really ties in with those other areas of abuse. When we talked about threat of harm, like Sylvia had talked about, it was really unanimous from the group that they did not want to get rid of we did not want to get rid of threat of harm, and that we did not want to incorporate it in the other abuse definitions, and wanted it to be a standalone, continue to be a standalone area of abuse.
Next slide.
Yes, please. So neglect, that was the other half of this, was neglect. And so what we did is we also delineated out a couple more things in neglect. As you can see, the current definition is negligent treatment or maltreatment of a child. Hold on just a second. Including but not limited to the failure to provide adequate food, clothing, shelter, or medical care that is likely to endanger the health or welfare of a child. Again, we, for the same reasons, had changed or proposed the modifications of providing adequate supervision, protection, food, clothing, shelter, medical or mental health care that is likely to endanger the safety or health of the child. Next slide. This is where it just got a little bit sticky, was the poverty exception. And so we did not reach a consensus of introducing the poverty exception. The proposed benefit of this exception is that the reports to the Oregon Child Abuse Hotline related to poverty or poverty-related concerns and neglect could be screened out and redirected to local resources where available, thereby reducing CPS involvement with families. However, there were also concerns about the ambiguity of the poverty definition, as well as what that reduction in or increase in screened out referrals and reduction in CPS assessments, how that could pose to children's safety. There was concerns about additional children falling through the cracks and having negative outcomes with that. So we did consider House Bill 2996 as it's related to the poverty exception. The interesting thing is that actually House Bill 2996 is specific to the finding of a CPS assessment. And then that poverty exception is applied there. And so some subcommittee members believe that the exception should be applied following the CPS assessment where it can be verified that neglect was solely due to a parent's financial resources. It's important to also note that the practice of screening out cases due to poverty is already occurring, but a broader application of the poverty exception could increase this practice. Primary concern remains that this could negatively impact the safety of children and potentially impact concurrent criminal investigations. Next slide. There was something that had come up that as we were talking about the threat of harm definitions, and this was just on Monday as we were going through this, is that the group was really leaning towards a separate definition of abuse for witnessing domestic violence because so many dynamics go into that. It really felt like it was a category all of its own. And so, and such, the subcommittee is considering the creation of a separate definition of abuse. Specifically for children who witness domestic violence or intimate partner violence. Next slide.
So I think that's it.
Oh, I think
There you go.
that's
Perfect.
Yeah. Okay.
So some consensus, but not complete consensus. That's long and short of it.
Thank you, Sam, for doing that presentation.
No problem. Sorry, Sarah, for just bowling through the whole thing.
No, it's okay. I think I think for both of us, it wasn't clear if you were doing it on your own or we were both doing it. So I think you did great, and I appreciate it.
No problem.
And Sarah, I don't know if you wanted to speak to some of the information you had shared with us around the implications.
Right. So my memory, and I think one of my memories is more of a conversation the broader committee had at one point. But one thing that that's already been mentioned here on this slide around having a separate definition of abuse for domestic violence, that would definitely be an implementation consideration if we're keeping threat of harm as is to apply to any kind of harm. Do we want to consider recommending there be an added allegation separate from threat of harm that is about domestic violence for better understanding, not only for our communities about the fact that domestic violence can constitute child abuse, but a better understanding for the registry and for service provision around how often are we assigning for domestic violence and how often does that become a founded disposition. And just for the whole group's awareness, we talked a little bit about, is there a way to capture that information in the data now? And there isn't a way to capture that at screening. There's no way really to, well, there's a way to capture how many are assigned for the subcategory of domestic violence when we assign it for threat of harm because the report is about domestic violence. There's no way to capture, if any, you know, what the extent of closed-it screenings around that concern is. And then at disposition, threat of harm is threat of harm is threat of harm. There's no subcategory or descriptor at disposition. And I had committed to the subcommittee on Monday that I would explore this a little further for everyone. So there was a time when disposition did include descriptors. So for all of the different types of allegations of abuse, but for threat of harm, they included things like threat of harm, domestic violence, threat of harm, sex abuse. And I couldn't remember exactly why we did away with that practice, but I did gather that information for the group. What was found is that upon appeal, when people were appealing founded dispositions for things like threat of harm and then a particular subcategory like domestic violence, they were successful in cases where they argued that the statute does not talk about domestic violence, and therefore they could not have a disposition of founded for threat of harm, domestic violence. So I think that might speak to the group's discussion around if you want to recommend there be some clarity and ability to track when domestic violence is the type of abuse, that perhaps that would have to be a statutory addition, that domestic violence or intimate partner violence would have to be an added allegation of abuse. I would also note that I see this speaks to witnessing domestic violence. I would note that with intimate partner violence, the witnessing of it isn't the only thing that causes the harm. And so we do screen for information around, okay, if the children didn't witness it, what, are they aware of it? What's the impact to them? Even if it's indirect, and do assign reports, even if they didn't witness the specific incident. So that'd be something to think about as well in implementation considerations is, if this group wants to make a recommendation about domestic violence as an abuse category, may want to stay clear of specifying that the child would have to witness it, because honestly, a lot of the harm that occurs to children isn't about what they witness. And then the other consideration, trying to remember, there were three. One of them was, I know, and this is the one that I think was actually maybe the larger group, just that if with any changes in definitions, there would need to be mandatory reporter training updates around that. Let me see if I can pull up the list, because there was one more. Oh, yes, just that as sort of a continued conversation around the potential of a poverty exception, that if there were changes made to statute that included a poverty exception for neglect, the group definitely talked a lot about how there would need to be systems already in place to support these families and to be referred to prevention services. So, having that as part of an implementation consideration around that, like, for example, maybe that if a definition was going to be changed in that way, that it wouldn't go into effect until more of the Family First implementation takes place, which we heard about earlier today.
Thank you, Sarah.
Mm-hmm.
And thank you, Samantha. So are there questions that folks have for the group about any of these findings?
I think Amelia had a comment in the chat about, Amelia, did you want to speak to this, where you've seen DV language that was specific to if the child perceived the domestic violence?
Sure. I'm in an office where I keep getting alerts that my internet is unstable.
Oh, gotcha. Okay.
So I just put it in the chat that yeah, I've seen other language, and I cannot remember where, but more than a decade ago, I worked in a DV shelter, but language around whether or not a child perceived the domestic violence.
Right.
Criminal law. Hey, that's helpful. Thanks.
Yeah,
But
that's in criminal law as well. Yeah, thank you.
yeah, that's like, you know, if they heard it or, you know, were otherwise aware of it.
Mhm.
I think there's still things that it doesn't quite encompass, like, you know, we know that kids in DV situations have a lot of other impacts, even if, you know, they're not in the home when the DV is happening. That tension and stuff is something that affects even, you know, infants. Um, and so, you know, I think that there are things that even perceived doesn't necessarily encompass.
Mhm.
Mhm.
Mhm. And I see Sarah's hand up as well.
Yeah, I just wanted to add to that. That is absolutely true, and even the way domestic violence is defined in ODHS, and I would imagine in other realms as well, it doesn't even have to be physical violence. There are other types of ways in which intimate partner violence plays out that is very impactful to children, and I imagine those without the violence without the violence may not be captured in the criminal codes. I don't know, you'd have to tell us, Brendan, but for the purposes of the CPS assessments, we consider all of that, not just the physical violence.
Mhm.
And Brendan put in the chat that he would agree that the criminal definition is too narrow to adequately capture harm to children who experience familial violence. Kristen.
Mhm.
Thanks, Sylvia. I just wanted to add a little bit of context about how we got here. So when this particular subcommittee was first meeting, there's the question of, if we get rid of the threat of harm definition, how do you parse that out? Like, really, what are the types of abuse that are being captured there? And it was really, exposure to domestic violence, potential exposure to like sexual abuse, for example. And I think there are like maybe 3 or 4 things that were sort of in that. But at the same time, threat of harm really functions as a catch-all in many ways for other types of abuse situations that are occurring. And I think that if I'm stating this incorrectly, please someone correct me. But I think that the group was weary of sort of moving away from that to eliminate that catch-all in some way. But it also made us wonder, well, should we be a little bit more clear about these other types of abuse that are occurring that largely are making up this category, and just naming them out in statute, but still keeping threat of harm? And I think that's kind of how we got to the domestic violence finding that we're talking about now. And I don't feel that I have enough expertise or knowledge or maybe information about what the pros and cons could ultimately be of specifically calling out domestic violence in its own type of abuse allegation, and whether that might potentially limit the harms and potential abuses that could be screened in, and what we as a group think about whether that would be necessary or not, because it is a very complicated circumstance for a family. And I have some concern that if we did include that as a specific abuse type in statute, that it might be too limiting in some ways. And maybe it doesn't matter, because that can still be screened in under threat of harm. But I think it would be worthwhile to really understand how it could play out if we name that as a specific abuse type. And I don't know that you can answer that right now, Sarah, or if there's anybody who could, but I think it's something that this group should keep in mind as we're moving towards formalizing a recommendation.
Sorry, I was chewing my snack that I was encouraged to go get on break. I would
Glad you
agree.
are.
I would agree that anytime we add an abuse allegation type to statute, I think it's going to carry that same risk. I would agree with you. So I think the question is, how would it have to read in order to be broad enough to allow DHS discretion to further define it in rule and procedure, without being so broad that it captures too much. Most of the time, what we're trying to do is further define abuse through administrative rule.
Would you have concern about specifically pulling out domestic violence and making its own abuse type, assuming that the statute, provided enough leeway to interpret it in rule, but it wasn't so overly expansive, while also maintaining the threat of harm definition? Like, is there anything immediately coming to your mind that is a big red flag for you or a green flag?
Not really, but I don't feel informed enough to make that judgment. I don't believe we've, and correct me if I'm wrong, I haven't seen anything that would compare, like, are there other states that have a specific domestic violence statute? And how does that read, and what outcomes has that led to for them? I know some states don't assess domestic violence at all. I am always sort of walking that balancing act, and I think you guys have all seen this from me, of wanting to respond to the right things without responding to so many things that everything is abuse. So I wouldn't say I'd be concerned, but I'm not excited about calling out a different abuse allegation. Like, I feel sort of neutral about it at this point without further study.
Can I ask a question?
Sure.
Just to share a little bit more of the subcommittee's thinking about what was the concern about sort of pulling out the threat of harm, physical abuse, threat of harm, mental injury, threat of harm, sexual abuse into that category of abuse. Because I'm always thinking about the data for you guys, right? To be able to not only have these things defined in statute clearly and applied in practice, but are you able to track the incidence of it, the outcomes of it, and really be able to then reinform yourselves about what's happening in your population? And so I may not be well educated about this, but I feel like from a reporting standpoint and from a understanding your population standpoint, that the actual incidence of a physical abuse event and the threat of a physical abuse event maybe happening in the future or imminently or whatever could go together naturally. But that's just how my brain works. What was your subcommittee's thinking around that, of not wanting to do that?
I can just provide my own opinion that I gave on that. I does not represent the subcommittee at all. It just represents, as we were going through, Sarah did a nice thing and created a poll for everyone to be able to vote. It was really, really handy. But the way the definition looked, it was confusing. I think it'll be confusing for workers. It's also, I think, on the due process end of it. I mean, it would show a founded for physical abuse when it's maybe a founded for a threat of harm for physical abuse. And I think that those are two very different things. And it really implies that something else has happened when it has not. And so I think for categories, I mean, I understand what you're saying for collecting data. I would maybe suggest that all of those specific things are put into their own little box to collect data on, kind of like I can't remember the term that you used, Sarah, but basically the identifiers that went along with that. So anyway,
the descriptors.
The descriptors. Thank you very much. So anyway, that's just one person's opinion. I'll let the others join in.
Subcategories. Sorry. Yeah, that's right. And those are the things that only happen at screening. They're not tied to the back end, to the disposition. Yeah. Thank you for that. Anna.
Anna.
Yeah, I think maybe I'm just going to echo what Samantha said, but the hesitation was very much there would be no way to differentiate threat of harm from the actual event. And so we'd end up shifting the ambiguity from one place to another place, which is why we got on the topic of the subcategories under threat of harm, that if we wanted to surgically reduce the frequency of some types of threat of harm without losing the ability to have a catch-all, because it seems like there's some benefit to that having some kind of descriptor so you could do that more effectively would be helpful, but we didn't know why it had been discontinued in the first place. So that was the detective work that Sarah Walker did.
Yeah. And Sarah, you're still in the process of sort of discovering that, right?
No, that's the information I got since Monday. So that was where I was talking about so in CPS, they weren't called subcategories. The subcategories are what we use at screening now.
Right.
When we had something in CPS disposition, they were called descriptors. And when we had that, and it would say, threat of harm, domestic violence, or neglect, lack of supervision. There were some cases on appeal that we did not prevail because statute doesn't say threat of harm, sex abuse, threat of harm, domestic violence. And so having a disposition that included that detail became problematic on appeal.
But what happens now when you have no descriptors?
It just says threat of harm.
And do they not appeal those?
No, they do, but they can't, they don't have the ability to prevail on a technicality that the actual disposition says threat of harm something. It just says threat of harm. They can still argue that all of the facts that we based that disposition on were untrue, but they can't make an argument that, well, you can't say threat of harm DV because that's not an abuse allegation in statute.
Right.
I know it sounds kind of
we're
crazy.
still doing it, is my only point, essentially.
We're not. When we send a founded disposition letter, which is what the appeal is based on, it just says threat of harm. It just says neglect.
Okay, but I thought you guys were using the STM approach so that
only it's screening
supports. Okay, so the investigators don't use that.
No.
I see. Sorry. Okay,
screening,
thank you.
it's really just there to help screeners, to guide them through, does this meet an abuse allegation or not? And so it's not carried, though it's in the screening report, it's not carried forward into the CPS disposition.
Okay, thanks for that.
Any other questions for the committee?
I would just add one more thing, that it's not that we don't know how many of the families that we work with, whether it's at CPS assessment or whether we open a full case and get involved with the family past CPS assessment. We have other ways to track what the family stress indicators are that led to the abuse. So we know the percent of cases we have that domestic violence is part of the equation, or that substance use disorder is part of the equation, things like that.
Are those reports out there somewhere, Sarah, or?
Probably. I can look into that. I'm sure they're somewhere.
Okay, great.
What we don't have is on the registry. It's not going to say why somebody had a threat of harm finding. But I'm not sure. I mean, I wonder what the group thinks would be the value in if someone's doing a background check on somebody and they see they have a founded disposition for threat of harm. Is it going to matter to them that it was domestic violence versus neglect? I don't know. But I think that's a question. Like, how important is it that the dispositions, if we can get the data in other ways to inform service provision and prevention and all of the things, what use is there in having that specific information on the disposition finding?
I think the committee also, I don't remember us considering the large number of threat of harms that are overturned on by the appeal process either. So that might be something to take a look at. Amelia, you had it first.
I just wanted to kind of ask about, you know, like back to the court piece, you know, is that how those play out in like a jurisdiction hearing. I, you know, did CPS work a very long time ago, but I could easily see there being an issue, you know, if you don't have these threat of harm categories defined, you know, that defense would have more room to argue. I also feel like if you consider moving some of that threat of harm under the primary category, which I know is not what was necessarily recommended, but like if you just made it also under physical abuse, I think you would be up against a lot of defense attorneys that would just be arguing, well, you know, he's never hurt this one individual child, and so, you know, you shouldn't get jurisdiction on this child. And you know, that threat of harm piece being a really critical part of that decision. I don't know, you know, how these changes would play out in those kind of, you know, DHS jurisdiction, you know, hearings. So curious if anybody who's had more recent DHS knowledge could touch on that. Yeah, thanks.
We'll let anybody put something in the chat about, or maybe Kristen's got an idea, but I think Scott had his hand up next.
I will yield to Kristen if she has a direct answer.
Okay, okay. Kristen, were you going to respond to Amelia's?
Thanks, Scott. Yeah, I just have a quick comment that I think might be helpful for Amelia. So I think that what we're talking about is actually a little bit different than what happens in court, Amelia. So when we're talking about the appeal process, it's that, you know, the person who received the founded has an administrative remedy where they can ask the agency to take another look at that finding and determine whether or not it was supported by substantial evidence in this kind of administrative context. Whereas what's going on in the courtroom, you know, that's completely separate. If you know, the agency came to me with the concerns that, hey, all this domestic violence is going on in this family, I have all these other concerns, you know, and we decide that, you know, petition needed to be filed in juvenile court, we could be really specific about what the conduct that's occurring in that family is, and then, you know, ultimately try and prove that in court at a jurisdictional trial. And so they're really two separate pathways. And
yeah,
a founded finding of abuse by the agency is not a predicate to being able to prove a petition in the juvenile court. I don't know if that helps.
Kind of. I think right where you were at the end there is where my question is like when you are filing a petition, you know, you typically have to file on all of the kids that you're wanting to remove. And if, you know, one of those children has never been, you know, hurt directly, really it is that threat of harm that is the area of concern, right? That like if they're abusing the other children and you leave that one child in the home, they become the target for the abuse, or, you know, things like that. I don't know how, you know, like if there is any relationship between changing the way that we talk about these outcomes, these findings, if we change these definitions, will that impact, the ability to be successful in like a removal or court intervention. I'm not doing a great job of articulating myself on this. I'm sorry, but hopefully that makes more sense.
I don't know that I can answer that question specifically beyond saying, I think it's really the role of the attorney for the agency to carefully craft, allegations in the petition and then ultimately try and prove them to a juvenile judge about why jurisdiction is necessary to a family. But the question of whether or not changing the definition could have an impact on the agency's ability to remove in a particular circumstance is, I'd say, an in-depth practice question that I don't think I'm in the right position to answer.
Okay.
But I think it's a good question.
So like the allegations that go on those court petitions are not necessarily in line with the findings of the DHS case. Is that?
They could be. I certainly invite Judge Love to weigh in here, but I see that as, it's part of the story that you're trying to tell the court. And if, my main witness at a jurisdictional trial is that child abuse investigator, the CPS worker, and I'm saying like, here's what happened. And if part of their testimony is, yeah, I did not find that was abusive, I would have some pretty serious concerns about what the court might do with that information. But I don't think that in and of itself would be a reason that the judge would find that the petition hadn't been proven, for example.
Okay. I don't think I'm asking the question in the right way to get to what I'm wondering. So maybe I'll work on thinking about that, and then maybe I can shoot you an email or something and try to figure out how to ask the question better, because I'm just kind of not getting there. Sorry.
Judge Love, did you want to add to this?
I'm going to add my own personal experience and not an OJD on this or tell you what would happen. I put the jurisdictional statute in the chat because there's very specific language in that statute. And what I see is the petitions that are filed in Lane County, they walk through this statute. And so most often we are seeing, I'm not going to read the whole thing, but whose conditions or circumstances are such as to endanger the welfare of the person or of others. And then we'll have the specific allegations, the parents struggling with substance use, domestic violence. Different kids are going to be situated differently. And so just because they're of the same family does not mean we have cookie cutter petitions for each of the children. And so I am guided by this statute and case law to help inform whether or not allegations have been proven. So that's my best way of sharing kind of what I'm looking for. And the statute doesn't have threat of harm exactly in it the same way I think that the conversation is going here. So it's pretty specific. But I think, Kristen, I don't know if you'd agree, when you were still coming to court a lot, I think that's that conditions and circumstances, like I don't know what percentage, but almost all of what we see under that.
99.9.
Yeah. So if that helps at all, that guides me on, I look at the petition and then that jurisdictional statute and case law.
That does help me, because they're not tied to each other. Like you could have a finding, but then that finding is not the grounds for which you're seeking jurisdiction. You have to go to that whose condition or circumstances. Like it's not like you're proving the condition and the circumstances. You're not necessarily proving the finding.
No, and it's the current, right? It's not like you could start the petition months earlier and for whatever reason not get to trial, and you have to look at what's going on now. So I hope that was at least something
very helpful.
Thank you. Yes.
Sarah.
Yeah, I don't know if what I was going to add is needed anymore, but because Kristen mentioned practice, it sort of cued me to think about, and I think this ties into what Judge Love was saying. We have a lot of assessments that result in founded dispositions, and we close it and we never see that family again. What causes us to file a petition and make allegations in juvenile court are those family conditions and circumstances that tell us the child won't be safe if we don't. And so that's based on partially on maybe what our disposition was, but it's also, you know, like I think one of the examples given was the parent's substance use. Substance use is not an allegation of abuse, but sometimes it creates a family condition that puts children's safety in danger, and they, you know, we investigate all of that. So it is kind of in some ways kind of weird that the two things are not attached more as far as like the actual abuse definitions in one part of statute and the jurisdictional part of the statute. But I think that's a good thing, because otherwise we'd be filing petitions on a lot more families simply because they had a founded disposition. And that's often not needed.
Is Scott still out there with your other question, Scott?
Not another question. Let's see. I'm just kind of a clarification on question about background check issues. If I could add into that. I was happy to let other folks talk about what was going on with the courts. So, so yeah, I would say in terms of whether or not what exactly is listed in the disposition, like disposition of like how this is a threat of harm. For us, it's far more that there is a founded disposition. So like that's going to be the issue. We're able to ask for the records from ODHS and review it. And then part of our background check process, and that's not going to be the same for every single state agency, but for our process, we look into lots of mitigating factors, like the time that the incident happened, what a person's done to address those activities, the severity of harm to the child. Like there can be a wide range of issues of how that CPS history is evaluated. But in terms of like whether or not they have threat of harm versus neglect versus like that doesn't really come into the factor. It's just more along the lines of the fact that they have a founded disposition from CPS, at least for our agency. Again, that's not going to be the same for every single state agency, either in Oregon or outside of Oregon, that might be able to get access to records. That's going to matter to them. So.
Yeah, thank you, Scott.
All right, well, if we don't have any other questions or discussion on this, I'm watching the time. It looks like it might be time for us to move on. So we have completed round 1 of our subcommittee work, and we want to thank all of you again who participated in that first go round. We are going to continue using the subcommittees as a mechanism to move this work forward. However, the composition of those committees is fluid and can change as the topics morph into morph into other topics. And so for those of you who haven't been a part of a subcommittee, you can be. For those of you who are part of the subcommittee, please think about staying with it. But just know that you can switch out with somebody, or you can stay on and we can add new people. We just want to make sure that we have probably 9 to 10 people in each group so that we have a good representation of the group overall. And then we'll be moving to round 2. We're anticipating 3 rounds of subcommittee work. So our next round is February 13th through April 9th. Well, actually, that's the long scope of it. Scope of jurisdiction will continue, and they're going to start on all the discussion about alternative pathways. So you had the presentation today on what's happening in Oregon. Our plan for March is to bring someone hopefully that can talk about a national perspective of what's happening with alternative pathways so that the scope of jurisdiction committee can look at that and possibly make some recommendations about what could happen in Oregon or might be considered in Oregon for alternative pathways. And then the definitions committee is really going to be focusing on identification of who can be a perpetrator in those definitions, especially since the jurisdiction committee has made some recommendations about scope, and we can put some identifying who we're talking about to the definitions. We need to think about whether we want to just turn or change our dispositions to one set of dispositions. If we do name, if we name the perps, do we then have just one set of findings, terms that we use for findings? Like right now, I think the CPS is using unfounded and founded and unable to determine, and then Otis is using substantiated, unsubstantiated, and inconclusive. And so do we want to just have one? And then we need to talk about a standard of proof as well. Due process is on there, but I have, we are not going to talk about due process. We're going to focus on those other three things in the definitions subcommittee. So we need to be identifying people at this point who are willing to work with the scope of jurisdiction and work with the definitions subcommittees, given that that's what we're going to be focused on. Well, I think there's another.
Yeah, let's talk about the next round as well.
Yeah. So the round 3 will be from April through May, and scope of jurisdiction will continue its discussions around. I'm gonna look at that later. Alternative pathways, the multidisciplinary teams, and there was some information I learned today, more about multidisciplinary teams in the chat, and then child-on-child sexual abuse, as we're gonna have in the future the complex sexual behavior group informing us on the status of their work, and then we'll be able to have some more specific conversations on the child-on-child sexual abuse. And the definitions committee would then also be looking at child-on-child sexual abuse around the definitions and go back to the discussion of, do we stay with dual definitions or not, given some of the recommendations we've already made. So we're kind of going full circle there. So that is the plan for our work. If you have an interest in any of those areas and you need a break from the committee but want to come back on later, you could do so. Or if you want to stay with the committee, we will take anybody who's willing to work on these issues. And then, I wanted to see what.
Yeah, if you guys want to pop into the chat, whether you'd like to stay on the committee, remain interested in both groups. Yeah.
So you see where it's confusing, even in the chat, we're looking at the confusion with these dual definitions.
Yeah.
Well, if it's a 418, then it's this, and if it's a 419, it gets this. It can be very confusing.
Yeah.
Okay, I want to be anywhere we're talking about alternative pathways. Okay, so that's scope of jurisdiction for Nicole.
Great. Yes, Nicole, we need you in that. That's great. Jurisdiction still for Tori. Yep. Because we made these slides a little earlier than we got clear on our, we do have a little bit of cleaning up on the scope of jurisdiction too, given the corrections issue and that sort of thing. So we'll be doing that first when we move to the alternative pathways.
Okay, so.
Oh, Judge Love. Awesome. Wow.
Judge Love, if you can.
We may pester you with emails about meetings, but don't hate us for it. You can always weigh in by email, right? On a lot of these things. Ashley's interested in both. Yep.
Yes,
excellent. They do all tie together. That's so true. Yes. open to either one where you're needed. Oh, good. Okay.
Brian, you want to move over to the, okay, Brian, I'm trying to capture all you guys right now.
We'll save all this chat too. We can. Is there anybody who hasn't yet been in the committee, subcommittees that would like to join at this juncture? I know Judge Love is one of those people, but if there's anybody else. All right.
Okay. All right, we will, so Anna's good with staying with definition. So I think what, next steps would be, to find a date. So, Leslie Ann and I will reach out, and probably do doodle polls to see where everybody's at, make some and then send out doodle polls where we can meet. Our next meeting isn't until the second week of March, March 12th, I believe.
Our next full meeting. Yeah.
Our next full meeting. So we would be having subcommittee meetings between now and then. So we'll send out doodle polls, possibly 2 meetings at least between now and then.
For each committee.
For each committee.
And what we do too, you guys, just to make it a little bit easier for those of you that are serving on both or something like that, is Sylvia and I never send up the same dates or time slots, right? We sort of get our schedules together and make sure that we're offering an array of dates that are separate from each other so that you don't have to choose, on a certain date or time between the two groups. But we do especially appreciate those that are taking time on both groups because it is an added time commitment. So we appreciate that for those of you that are willing to do that. All right. Questions or any other clarifications anybody needs? All right.
Right.
Excellent. Okay, so moving along then. So we wanted to just kind of touch base a little bit on the parent survey outreach and distribution. I know we're in the process of kind of working with Lisa Bender and getting some clarification on making sure that our content for these surveys, especially to parents and to staff, is something that can be supported, is, not overburdening folks, is not violating any confidentiality, considerations with narrative input and all of those sorts of things. But I did just want to get this in front of everybody to, kind of reconfirm the things that may be kind of buried in our minutes from our previous meetings about, notwithstanding the confirmation of the content for the surveys, we still want to be sure we're starting to think through and are confirmed about some of the distribution channels that we want to utilize to try and get participation into folks responding to the surveys. And so one of the things, this really is a representation of that. So if you see your name up here, and you read the little description of the route we're getting to parents for through this channel, right, to actually get the survey out to parents through these various pathways. Please confirm that we've represented this accurately for starters. And then if there are any barriers to this or things you've discovered in the meantime that we need to adapt any of these channels for any reason, please share that as well. Now, I know Scott has did his homework really fast. Thank you, Scott, for doing that and got back to us that the preschool promise, the preschool for all, and the childcare hubs were not really a candidate channel to get to parents. And maybe, I don't know, Scott, if you want to share any more about if there's a lesson learned there about trying to utilize that particular avenue for accessing parents that we should know and may apply to anything else that we're doing.
Just at this time, Delk does not want to participate in the survey. That's by marching orders from higher up. So I'm sorry, that's where we will not be helping facilitate this. So that's our part. I'm sorry.
So it's more about what the survey is looking like right now than it is these groups not wanting
It's just my leadership feels this is not something that should be distributed at this time from our agency. So
I see. Your own leadership in Delk. Yeah.
That's correct.
Yeah, I gotcha. Okay.
Leslie Ann.
Yeah.
This is Annalise. I can help get this information out then to our preschool promise programs, preschool for all programs, and I can get this information out to the childcare hubs for them to share. I'm only going to share a link, so I got to have a link to the survey.
Of course.
And I will, but I will be happy. Our union can do what Delk will not do. We do not have any problem providing that service to this group. So yeah.
Okay.
Yeah,
okay.
we can take care of that. We can get that.
Great. And Scott, that doesn't put you in any kind of weird bind or anything, since we're all in the same committee. Because I mean, it's interesting. It's an interesting challenge, right? Because the committee itself, I would imagine, I mean, the messaging on this, right, is that the committee is sponsoring the ask for this information. And so no matter who literally is helping distribute this, it's on behalf of this committee. Sarah, go ahead.
I'm going to try to articulate what's in my head and what Lisa Bender and I have talked about a little bit, and I know we're all going to meet to talk about it. I think from the ODHS perspective, there is some hesitation about the surveys going out to parents, both for the reasons I think you're talking about right now. I think one thing is no matter who it's on behalf of, depending on how it gets communicated, it's going to seem to people like they're getting it from whatever organization gives it to them, or at least that organization is supporting it. And which from our perspective makes a lot of sense, right? Because we know what the purpose of this survey is. But when I imagine being a parent and my school district, and I am a parent, and my child's school district, or, you know, the whatever other, you know, their coach or whomever sends me a link to a survey, I'm going to assume it's coming from them. And then I'm going to open that survey. I'm going to be like, why are you asking me about protecting my child? I've never had an alligator. Like, I think for us, the concern is how is it going to get communicated so that it's clear who it's coming from, what the purpose is, how it's going to help, what's going to be used with that information. And I'll be honest, I'm a little apprehensive about particularly our marginalized communities receiving this and how they might perceive it based on the current state of things in our nation.
Yeah, no, that's a great point. And, you know, it's interesting that when we originally designed these questions, we were back in a more preliminary stage of understanding the impact of some of these outer circles of the scope of jurisdiction, for example, the impact to families, you know, around being involved in those kinds of investigations when it's a third party that, you know what I mean, they're not the perpetrator. We're talking about when it happens to some, and now we're sort of down the road on that, and it's starting to make me feel, what is the effort that we really want to make to ask parents about that's really going to contribute to this committee's work? And now I'm starting to wonder if it isn't an easier ask and a more relevant ask to talk about some of these prevention kinds of alternative pathway ideas or something that we would want to lift up and ask. It's a much more neutral ask, like what kinds of things people need, what kinds of things they would utilize, something like that. But again, that may already be happening with Prevent Child Abuse Oregon and some other capacity. So I'm just starting to think about relevancy of this big lift to do this at this stage, when we've already kind of marched down the road on some of these recommendations. So Annalise, I saw your hand up next.
Brian had his hand up before me.
Oh, sorry. Okay,
That's okay.
I'm not
Yeah,
tracking.
no, I before I raised it, he already had his hand up.
Go ahead, Brian.
I think Sarah said most of what I was going to say. It's just, I think for schools, it's a difficult one, because whenever some of the folks that we want to have feedback from are people that have had experience
with child welfare,
because we've made a report about concern. And so when we then send a message out to parents, it kind of brings that feeling probably to the surface, or could bring that feeling to the surface, because it's a breaking relationship every time that we do it. We have to do it, the right thing to do, and there's no way around that. But for parents, sometimes it can feel like a break in relationship. So that's the concern about schools or school districts sending it out. And I'm not sure the best way around it. That's why I said maybe we can talk to the Department of Education or even the Health Department or somebody else to look at doing it. I understand the intention, but it'd be hard for schools to possibly.
Yeah. As one of the biggest reporters, right? To ORCA. Yeah. Annalise, go ahead.
Okay, so maybe I just missed something, but I apologize if I'm way off base and I missed something. I'm sorry. I maybe erroneously assumed that this was going to be a professionally put together survey campaign, where there was going to be some sort of toolkit that all of these organizations would be using to send this out. For example, Child Care Resource Referrals and Early Learning Hubs send out a survey every other flippin' week in some cases. I'm getting surveys that are being done by PSU, Eastern Oregon, Western Tri-Woo, this group, that group, Henny Penny over here, and Farmer Joe. Every time I get one, it doesn't say that the CCR&R is looking for information unless they are the ones looking for information. And they do, like, I think maybe 4 or 5 different surveys a year in Clackamas County around different issues with childcare for childcare providers. So I just assumed that we were going to get, some sort of toolkit with, hey, this is where it's coming from. This is why we're doing this. And we would just be sharing this out. I didn't.
Yeah, that is true.
I didn't think we were all gonna be saying we're getting information. I mean, this is a legislative work group, House Bill 4086, and we're collecting data universally from every parent we can get information from around their past contacts or their, what they need, or, whatever context they have, right? Whatever we're looking for, right? And that this is universal. No one's being targeted. So I guess I don't I'm just having trouble wrapping my head around this. Childcare providers regularly report abuse, some of us more than others, or suspected abuse. But I don't think childcare providers would have any trouble. We've shared other surveys very similar to this. There was a survey last year about this time that we passed out along these same lines, and what the survey was from some private college organization that somebody was doing a research study on parents' experience with, social services in terms of getting supports and public assistance. So unless I'm missing something, I guess I don't understand. I don't understand where this this real direct deep connection is going to come from, and people are going to feel like we're targeting specific families we reported and stuff. I guess I just don't understand where this where this is all coming from, because this didn't seem like this was what this was for me.
Mm-hmm. Mm-hmm. And what I'm hearing people say, and you guys can correct me, is that is all true, that there will be standard language. It will be very, clear what the messaging is around this. But just by virtue of it being received from someone at your school, for example, through email or whatever, right, to some roster of parents within the school, or I mean, again, we haven't talked specifically about the how of the distribution channel, right? Is it a poster that goes up in the school with a QR code on it? I mean, there's lots of ways that you can disconnect this from, that kind of personalized outreach as a way to avoid this. So this is kind of all the things that we wanted to talk more about in terms of being precise about how we get this word out, how we encourage people to participate, and how people might feel when they receive such a request. Brian?
I think there would be a lot of school districts and school district leaders that would probably share the same thing with you, is that we're not talking about a generalized survey here. A generalized survey about the well-being of the services provided to kids or families across a wide range of topic and scenarios. We're talking about something that's more focused.
Mm-hmm.
And that in the first place is going to create anxiety and mistrust among parents and families. That's just, unfortunately, that's the reality.
Mm-hmm.
We're a safe place for parents and families if they're upset about anything. Schools are a safe place to vent frustrations. And anytime you send out a survey tool, they vent frustrations. I'm just going to tell you, it doesn't matter the topic.
Oh yeah, I've
if you send them
experienced
something
that
out
many
about,
times. Yeah.
hey, we're hoping to improve our facilities at a school district or whatever it might be, they're going to vent all sorts of frustrations about it. If you ask them about mental health supports across a lot of different areas, when we have an ODE survey, that we have ODE surveys that we have to put out, which I think we should, that are asking about students' experiences and families' experiences, they vent frustrations, and it can be very contentious. Not for every one of them, but for enough where it's going to be problematic. But if we have something that's focused like this, it is going to be a difficult thing for schools to directly put out there without there being a lot of backlash. And I think to Sarah's point too, there is increased tension and anxiety about anything that we're going and asking to get input in from families right now. We have a high percentage of our families are in such a state of fear
about immigration,
and all the things that are possibilities for them. And so to do anything other than what we have to, that we're required to right now in the way of that, it isn't a good time, and it's a difficult thing when they've got something that's this focused, because it is a hard one for families. I'm just going to put that out there. I don't know the best group to help get that or how to do that, but it's probably not going to be as effective going through schools.
Mm-hmm. Mm-hmm. Yeah.
I mean, as a parent who receives like 5 emails a day, I'm like just counting on my phone here, from the North Clackamas School District, like I'd be okay with not getting a survey through the school district. And to be fair, I've gotten 4 in the last 7 months. So they do pass on a lot of stuff, a lot of opportunities. They, North Clackamas, I could do without having all the Blazers advertisements and all the other stuff. So I mean, I do kind of get that. So I do kind of get that. I just, and I don't know, maybe we don't even need to do a survey anymore. I mean, I think that's part of it, but I would like, before we make any more determinations, I would offer that I would just like to see what the survey says. I'd like to see what the materials are with it.
Well, y'all have the link to the survey
Right,
itself.
right.
Yeah.
So, but I'd like to see what what does the link look like, and what does the material say that's going to go with that?
Yeah, the cover
link,
message.
right?
Mhm,
Right.
mhm.
And if it's really generic, like I don't think.
But
and education, look, K-12 education is different than post K-12 or post 12 education is different than early childhood, right? So while the schools might not be a good avenue, I think that we can, through early childhood, I think we can reach a lot of families. And it's not, it may be unfortunate that we don't reach as many families with older children. That might be an issue, but at least we'll reach some families.
Yeah.
And hopefully we can get people sharing and spreading, and
I think the sensitivity that I'm hearing people talk about, though, is the fact that you're asking people about a very intimate experience that they may have had with child welfare services, not just general information about what do you think child welfare services should be doing these days, or what's your experience with in help and support for your family, or that
then
sort of.
Then let's scrap it, Leslie. I mean, if
That's
people are
what-
really worried about it, then let's scrap it, because there's no
we don't have
talking about
any
it, that
we don't have any
you know.
particular attachment to. What we do have an attachment to is making sure, because we don't have it in this committee very directly, are the voices of enough of the community who have experienced as recipients, right? The child welfare issue. And that's what we may have to go back to the drawing board on. How do we best sensitively acquire that, right? In an environment and in a way that will build, not damage trust, not, create other ancillary problems, and meet the need of this committee to get information that sort of helps corroborate or gives voice to or help shape the kind of recommendations that will serve folks that are served by this system. Sarah, I'm going to let you have the last word, because we're coming up on 5 to 4. And I don't think we're making a decision today necessarily, but go ahead, Sarah.
Yeah, it was just a thought for you to consider, if if the group does decide to scrap the surveys. I wonder about focus groups, and I wonder if we could somehow leverage our parent advisory committees around the state. And
definitely,
because
those are that's one of our items right here. Yeah, that we wanted to do. And if that's a more sort of agreed upon environment, that these folks have already stepped up to say, we're willing to help shape this system, right, based on our experiences, then we at least are over that initial hurdle to some degree, right? And is that enough, right? Yeah. So, but that's what I think we're going to have further conversation about, with Lisa and others. So let's take this conversation that we've had here today. Really appreciate you guys' candor about this. It helps us understand more of the context, and then we'll come back to you with kind of what we may brainstorm together, Sylvia, you and I, and with Sarah and Lisa and others, to just figure out what's kind of our best impact here, and that has the least impact negatively on those we're inquiring of.
Well, and I think that what the committee needs to keep in mind is we really do want to hear from the folks who are impacted by the decisions that you all are going to make. Right?
That's right.
So marginalized communities are the people we need to hear from. And we don't have this committee is not representative of those marginalized communities. And and even in focus groups, they're going to say things that people aren't not necessarily going to want to hear. They're going to disclose information. That's what they do. But I want to see focus groups that are representative of the folks who are impacted by these decisions.
Mm-hmm. Exactly. All right. So we'll add this to a future agenda, right? To loop back around to, you know, a clearer proposal on what makes sense around this. Fair for today? All right, good. Let's see, just quickly, you know, like I think Sylvia mentioned earlier, we're going to have our guest speaker around really getting a better look at this national perspective, right, around alternative pathways. That we've already reached out to some folks there to secure them for our March 12th meeting. Is this right now, Sylvia? Do we have the update for conflict? Did we decide to move that out, or is it us that's moving out and they're still going to present to us?
Right. They're going to come and they're going to present on
Right.
What
Okay.
what the committee work has been for them.
Yeah. Okay, good. And then again, we'll do this similar kind of process with the subcommittees. If there's any further recommendations that we've all come up with, like for example, us around the corrections facility issue, right? We might present that next month. And anything else that the definitions committee may be refining. And then if we can, we'll check in on the survey development issue or launching issue or decision issue around that. Okay. So again, another full agenda on March 12th, as we had laid out in our big picture a couple of meetings ago. Any last closing remarks? Anybody want to share or anything you want to add, Sylvia or Sarah? All right. Well, I just want to thank everybody again. Great discussion, great conversation. Really appreciate find out how those impacted. Want to provide information? Yes. Great question, Judge Love. If possible, is there a way for us to find out how those? I think the parent advisory group would be a great source for that. Don't you think, Sarah? To be able to ask those folks directly, you know, what?
Yeah. I also wonder if they'd be willing to help distribute surveys, if that would be a better avenue. I don't know.
Yeah.
Yeah.
Possibly. Yeah. Yeah. Absolutely.
Or if not doing the survey, if just doing focus groups, maybe they'd have great suggestions for how to get, you know, how to target people who actually have the lived experience, you know? So
that's right.
casting a net to the right group so that the people we're hearing from are people with lived experience.
Of course. And then we could put that lens over the list of great ideas for distribution we already have. Just Love. Yes, go right ahead.
All right, I just wanted to clarify. It was a webinar a bit ago and it was pretty impactful with parents, people who had been through the system as parents and youth. And they were pretty blunt about like feeding me at a focus group is not meaningful to me. I feel like it felt not genuine.
Right.
And so it really made me think about like how would it be helpful and meaningful for the folks who we are impacting to give us input on how to get the information. And it was like, I can remember how they looked. I don't remember what webinar it was, but it was pretty powerful. So
no, that's very powerful, Judge Love. And I think our original idea was like, we need that relational intermediary, if you will, right? when you stop and think about it, we're not really looking for the entire roster of every school district in the state. We're looking for a trusted relational partner that can say, oh, I work with these families and I know they would welcome the opportunity, right, to share their opinions and help the system be better and blah, blah, blah. But when you just go out there and dangle gift cards and food from a bunch of strangers that are showing up and just peppering people with questions, they're absolutely right. It's not very effective or welcomed. Yeah. So we will definitely, everybody's got to roll off. They all have 4 o'clocks. Annalise, a last comment?
Yeah, I just want to say I know several of my own childcare families.
Yeah.
Love an opportunity to
See,
speak because they've come to me and they've said, Annalise, this is what happened, and who can I complain to? And so I sent her to the governor's advocacy office.
Yeah.
So I think, there are people that, and I have a childcare provider who just went through this with DHS as a parent. She's not a child in that role. She wasn't a childcare provider. She is a parent. And she's very, she was like really upset about certain things. So,
and we also want to be careful about setting the wrong expectations, because we are not a group that is reforming the entire child welfare system, and we don't want to sort of put that out there that this is enough. We can't stand behind that as a follow through. And so that's really important to think about. What is it we do want to know, and match it against the people you're talking about, Annalise, who may want to speak to that. You know what I mean?
I think there's an argument to be made, though, that there should be something on the back end, a customer service aspect, when you've gone through something, that there should be some place, right, where you can
be able to
send
vet
information
whatever else is
and
on
give
your mind.
feedback, right?
Yeah,
And give
I agree.
feedback, right?
That's a great point.
I think
That's
it just points out, this whole situation just points out that there isn't really any place for people to go if they really do want to speak out.
That's right. That's a good point. Yeah. Okay. Thank you so much, Annalise. You always have such thoughtful contributions, and everybody did today. So we will end it there and see you in the coming weeks. Thanks, everybody. All right, and I'm gonna save this guy again.